For those who like to become a doctor as medical career,
there is a law called Republic Act 11509 was approved on December 23, year of 2020.
aka as doktor para sa bayan.
It covers free tuition and other school fees.
Internship, board reviews, and living expenses are also free. This is good news, right? But for now, let's discuss the 5 pandemics of the last 500 years that challenge our health.
first on the list was the most severe pandemic in recent history, the Spanish flu. This influenza attacks the respiratory system and is highly contagious. When an infected person coughs, sneezes, or talks, the respiratory droplets will be generated through the air, making the other person nearby to be infected as well. During this time, there were no effective vaccines or antiviral drugs that treat the flu. Only the non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, and limitation of public gatherings were applied. Also, the vulnerability of healthy young adults and the lack of vaccines and treatments created a major public health crisis, and the number of deaths was estimated to be at least 50 million worldwide.
Still a flu. The Asian flu was a virus subtype H2N2 that originated in the year 1957 that was caused by avian influenza. The number of deaths is estimated between 1 to 4 million worldwide, making it one of the deadliest pandemic of all time in the history of mankind. Microbiologist Maurice Sillerman ends the pandemic. The virus cultures to vaccine manufacturers on May 12, 1957, and a vaccine entered trials at Fort Ord on July 26 and Lowry Air Force Base on July 29. Hillerman vaccine is believed to have saved hundreds of thousands of lives.
And now with the flu yet still happening today, the origin of the human immunodeficiency virus HIV has been a subject of scientific research and debate. The virus was identified in the 1980s. It's a type of lentivirus, which means it attacks the immune system. When and where did HIV start in human? The first verified case of HIV is from a blood sample taken in 1959 from a man living in what is now Kinshasa in the Democratic Republic of Congo. There are numerous earlier cases where patterns of deaths from common opportunistic infections now known to be AIDS-defining, such that HIV was the cause, but this is the earliest incident where a blood sample can verify infection. Symptoms of HIV includes fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and etc. Protecting yourself from HIV begins with understanding how the virus is spread. The virus can be passed in only certain ways: during sex, with the person infected with HIV, by sharing a contaminated needle, such as through illicit drug use.
Severe acute respiratory syndrome, or SARS of 2008, first identified in China that year, caused by a coronavirus. WHO reported that SARS has a total of 8,098 people infected and 774 of them died. Most patients age from 25 to 47 years old. However, there are reports that it was found in teenagers age 15. Like any other viruses, it can be transmitted through droplets and it is airborne. There is no cure, proven antiviral therapy, or vaccine for this sickness. Patients were isolated in a negative pressure room with barriers to protect the health workers from risk. On the brighter side, the officials deployed a massive number of medical workers to assist with on-site investigation and around the world, and many more. In 2019, another coronavirus hit the globe called
COVID-19. It is caused by the novel coronavirus and first reported in Wuhan, China. It spreads through saliva droplets or when an infected person coughs or sneezes. The most common symptoms of COVID-19 are fever, dry cough, and fatigue. It may develop from 5 to 6 to 1 to 14 days. This is why infected people are advised to go on quarantine to prevent the spread of the virus. While there is no silver bullet at the moment to treat the virus, there are some medicines that were used such as remdesivir and Avigan. Aside from swab, saliva, or blood testing, it is also advisable to get the vaccine with FDA approval. As the saying goes, prevention is better than cure. Sadly, as of February 3, 2021, there are 103 million cases and 2.24 million deaths around the world due to COVID-19. Despite the current situation, this pandemic led to enormous improvements in public health. Indeed, several strategies such as health education, isolation, sanitation, and surveillance improve our knowledge of the transmissibility of influenza and other viruses, which are still implemented today and proven effective in preventing the spread of related diseases.
In this time of pandemic,
always wear face mask.
And face shield too.
Lastly, sanitize your hands using alcohol.